Hi everyone, it's Dr. Ansari. If you're in your 40s into your 50s, maybe, early 50s, you might be noticing some changes to your body. You may be unsure of what's happening. Maybe you've gone to the doctor a few times and they keep telling you nothing is wrong. So let's go over what might actually be happening. So the answer may be perimenopause. You're entering the menopausal, the pre-menopausal period, or I should say the period before menopause actually hits. And menopause is defined as no periods for 12 months. So there's a certain phase called perimenopause that you enter, and it may precede menopause by 5 to 10 years. You might be noticing changes to your periods. They're getting heavier, they're getting lighter, they're getting erratic. Some vaginal changes, like you're having more vaginal dryness, maybe more instances of pain with sex. Maybe you're noticing weird discharge, maybe funky odor or different color or texture. You go to the doctor every time, the gynecologist, and they keep telling you everything's fine, there's no infection. Maybe you're having more urinary tract infections. Maybe you're noticing you have to pee a lot more often. Okay, before you can go on a car ride for 6 hours and be fine, but now you can't make it more than like every 2 hours you have to go. All right, so maybe you're noticing changes to your bladder. Maybe you're noticing more urinary leakage. Okay. Maybe more with a cough, sneeze, laugh. Maybe when you gotta go really bad and you just start leaking a little bit before you get there. You might also be noticing more instances of hot flashes and maybe some moodiness, okay? So all of these things are going to creep up on you before you hit menopause, and you're going to start noticing it. So essentially what happens is this is your estrogen level and this is your age. When you're born, there's no estrogen level until you hit about your puberty level, okay? And this yellow line is when you start having periods, or your threshold for when periods occur or don't occur. So here at 15 or whenever your age was, you started having periods and you were doing great with high estrogen levels. But then what happens is once you enter your 40s, your periods start, your estrogen levels start declining until you hit this yellow line again, at which point you hit menopause and your periods stop. Okay, and then your low estrogen levels into your postmenopausal years. And this is where some of these symptoms start. Some of these symptoms will continue into your postmenopausal years down here, okay? Or you might notice other changes occur, all right? But just remember that these are phases in life and there's nothing you can do to avoid it. So, before you hit period was a phase in life. Then once you hit a good estrogen level and you were, in your 20s to 40s, you can have children. There weren't a whole lot of health issues, maybe. And then you enter this perimenopausal phase to the postmenopausal phase. These are phases of life, and there are some treatments that we can do to help you deal with some of these issues, but just remember that we don't have a treatment for everything, or we have limited treatments for some of these issues. So just remember that it's a phase, hopefully, and maybe you'll get out of it, but there are some of these issues that will stick around long term.